Good afternoon and welcome to our Tuesday COVID-19 briefing, our effort to continuously provide you information that's important to all Tennesseans as we face this COVID-19 pandemic together, and to provide you with information about what we're doing to mitigate the spread of this virus, but also to mitigate the damages both economically and from a health standpoint in Tennessee. As I mentioned yesterday, there are reports of encouraging news, and there are indications that the spread of the virus may in fact be slowing, not only in our state but in other places around the country. And these improvements give us hope for return to a normal life. But I want to remind Tennesseans that data changes rapidly. And even though the data is changing rapidly, we cannot change in our diligence and our vigilance and in our efforts to continue to do the things that have actually caused the decrease in the speed of the spread of this virus. We have to be consistent in our efforts to stay home, to stay apart, to do the small things that save lives and that decrease the long-term risks in our state. Every time you do those things, you move us a little bit quicker to the point in which we can get our state back on track again, and we believe that that is certainly coming. Today we have 4,138 confirmed cases. We have lost 72 Tennesseans to COVID-19, and there are now 466 recovered cases as well. So today I will be discussing efforts around unemployment benefits and our work to provide those benefits to Tennesseans that have lost their jobs. I'll also be talking about our stewardship of federal programs that have been put in place for small businesses, including this new Paycheck Protection Program that just went into place. You know, COVID-19 has caused many Tennesseans to lose their jobs, and we are seeing record spikes in the number of unemployment applications. It is a very difficult reality of what this pandemic has done. One of the real detrimental impacts that have happened to Tennesseans in the midst of this. On average, we typically see over a 3-week period about 10,000 initial unemployment claims, 10,000 over a 3-week period. Over the last 3-week period, we're on track to be about 25 times higher than that, with 250,000 initial claims of unemployment of Tennesseans. Early on, we saw that this pandemic was creating severe economic difficulty and disruption to hurting Tennesseans and hardworking Tennesseans. Early on, we extended unemployment benefits to those who were quarantined by a physician and were temporarily away from work. Also, traditionally, unemployment benefits include an additional week to distribute as we verify information, but we suspended that additional week, the regulations around that additional week, to help people get paid faster. But as the rate of unemployment claims escalates, our Department of Labor is projected to pay more than 100,000 claims this week, pay that many claims out. The massive number of new claims has required additional resources to make the system run efficiently. You can imagine the impact on our system as this massive number of folks have filed for unemployment. So I've asked Commissioner McCord to be here today. He will speak in a few minutes about the improvements that we are making to the system, to process those claims faster and more effectively. Congress came together last week and passed the CARES Act, and they have made more funding available and greater flexibility available for Tennesseans through this pandemic. Now, there's certain CARES Act provisions that are on track to be implemented as soon as next week. One unemployment issue that we're tracking really closely is the unemployment benefits for the self-employed, or for those who file a 1099. Self-employed Tennesseans need this assistance. We're working with the federal government to make sure that they get it. We are hopeful for a quick resolution to this. Commissioner McCord is going to speak to our efforts to advocate for the self-employed, as well as we implement guidance from the federal government. As that federal relief package makes its way to Tennessee, we want to ensure that small business owners have awareness of and access to the funds that can help curb the economic losses in our small businesses all over the state. In March, we completed our request to the SBA, the Small Business Administration, to officially pursue statewide relief opportunities for Tennessee small businesses. And our approved declaration ensures that loan assistance is available for small businesses in Tennessee, private and nonprofit organizations as well, with low interest loans up to $2 million in assistance per entity. This is really crucial to helping Tennessee businesses weather the temporary losses that they will incur as a result of COVID-19. And I do want to remind Tennessee nonprofits that they too qualify for those SBA loans. But in addition to traditional SBA loan assistance, the federal government has just launched something called the Paycheck Protection Program. This Paycheck Protection Program is a loan that's designed to provide a direct incentive for small businesses to keep their workers on the payroll. SBA will forgive loans if all employees are kept on the payroll for 8 weeks and the money is used for payroll, rent, mortgage interest, or utilities. This went live on Friday. It's an unprecedented government initiative to provide financial assistance to small business community and others. And we want small business owners across our state to be aware of this new program and to be aware that it has gone live in our state and that they can pursue this incredibly important assistance for small businesses in the season ahead that they face as a result of the difficulties around COVID-19. This went live on Friday. The program authorized $350 billion in fully forgivable loans to help small businesses maintain payroll during the pandemic. Now, to put this in context, the SBA typically handles about $28 billion in small business loans in a year, so implementing this $350 billion loan program, and remember, these are forgivable loans if used correctly. To implement that program in the middle of this crisis is a major undertaking. The program is being run here in Tennessee through local financial institutions. So our local banks here in the state of Tennessee are carrying this out. We want to thank our Tennessee banks and our credit unions for working quickly to help our small businesses in this program. I've asked Commissioner Gonzalez of Financial Institutions to give a brief update. If you would, Commissioner, come up to give a brief update regarding the first wave of this Paycheck Protection Program, its implementation for our state, and how it can help small businesses all across Tennessee.
Thank you, Governor. Appreciate this opportunity to talk about this program. If I could, I want to give a brief update first with regard to the Tennessee banking system, as well as its role with respect to the Paycheck Protection Program. First of all, the condition of the Tennessee banking system is strong, and stronger than where we began 12 years ago before the Great Recession. And all that is a result of prudent financial management throughout Tennessee. Tennessee financial institutions are in a good position to facilitate relief to citizens. And the Department of Financial Institutions is working closely with all of our institutions to help them meet the needs of Tennesseans during this critical time. Let me briefly mention the SBA's Paycheck Protection Program. And as the governor mentioned, this program just went into effect on Friday. So there's still a lot of work that's being done to make it fully functioning. But it is unprecedented to provide financial assistance to Tennessee's small business community as well as others. So working in partnership with the federal government, Tennessee banks are doing everything they can to process loan applications quickly, but businesses should expect that it will take some time for the program is fully functioning. Many banks were required to wait for the necessary approvals from the SBA to access the system, so they're not able to accept and process loan applications, some of them until this week. But we are seeing results. The banking industry has been working directly with Treasury and senior SBA staff since the launch of the program to address any and all system changes as they have come up. Despite the program being as streamlined as possible and to make borrowing as efficient as possible, banks will still need to verify that a customer is who they say they are and require payroll information for their loan application. All customers should be prepared to provide this information to verify their application. Each day, the process continues to improve, and I've seen this every day as we work with our banks in the state. If you are a small business that is affected by the coronavirus and you are interested in one of these loans in order to maintain your payroll, you should contact your banker. They will work with you to access the program or find another solution that best fits your circumstances. We urge Tennesseans to have patience with banks as they work to implement this new federal loan program and stay on top of all resources that are available to borrowers. Financial institutions know that small business is the backbone of the economy and are committed to helping each of you through this unprecedented hardship. Thank you, Governor.
Thank you, sir. And I just want to reiterate the awareness that we have that small business owners across this state have borne a tremendous burden to be a part of slowing the spread of this virus. You've been asked in many cases to close your businesses, to cut back. Certainly the virus itself caused a tremendous slowdown in businesses across the state. And I want small business owners to know that we know you have borne the brunt of this, but we are working very hard with the federal government and with our own local institutions to make sure that we can assist you through this process and that we can actually be there to help you get your legs back under you and back on your feet when the time is appropriate. And we are committed to that process all the way through this pandemic. I want to ask Dr. McCord, our Commissioner of Labor and Workforce, to come forth and talk just a minute about our efforts in the state regarding unemployment and benefits to those who have lost their job during the COVID-19 pandemic.
Thank you, Governor. As the Governor mentioned, we've seen a sudden and very high increase in the volume of first-time claims. As you can imagine, that puts a strain on both our people and our systems. And so let me update you just a little bit about what we're doing on both those fronts. 2.5 weeks ago, we had 20 front-facing individuals helping people process claims and file claims. That number is 200 plus now. We need more, and we need more especially on the weekend. So within the week, we'll be adding another 50 so that we can fully cover 7 days a week for those of you who are looking to file claims. On our information system front, we have gone through one major upgrade. We're in need of another one in order to process those claims quickly. That will come within a week or so. We're expediting that as much as we can with our vendor, with help from our IT department at the state. Finally, we have agreed with the federal government on several provisions from the CARES Act as it relates to unemployment insurance. The first one is known as Pandemic Unemployment Assistance, which you will see as we go forward that this will cover your sole proprietors, your 1099 employees, and that sort of thing. The second major one is called Federal Pandemic Unemployment Compensation, and what that does is it adds an extra $600 to any claim that's filed on top of the claim that you would already get. So you get an extra $600 no matter the amount of the initial claim. There are also a couple of provisions that extend those benefits. So we have agreed to those benefits, and we have received guidance this week. Our programmers have had one full day to work with our vendor programmers, And we'll have more information in the next few days about exactly when that implementation date will be. But I want to make this point. For those of the 1099 employees who have already filed, we will go back and review your file based on this new guidance, and so see if you're eligible for that, even if you weren't eligible for your traditional unemployment insurance. And on the $600 addition, as soon as we get that, that will also be backdated from the time of the agreement. So no money lost. Understand that time is of the essence. We feel a huge weight and a huge sense of urgency at the department to get these funds out, to get these benefits out to Tennesseans. And in a nutshell, Governor, we are making progress, but we still have more progress to make.
Thank you, Commissioner, and that's true for all of us. We want business owners and individuals who are facing real economic times, difficult times. We are making progress, but we have a lot of progress to make. The same is true on the health side of this crisis. And I'll ask Dr. Piercy to come up and give us an update on where we are from the health side, some of the numbers, some of the positive things that we're seeing happening. So, Dr. Piercy.
Thank you, Governor. As the Governor mentioned, today's case count is 4,138. That is up over 300 from yesterday, but that's in the face of adding 5,500 tests in a day. That brings our total test amount to almost 53,000. Quite frankly, that's remarkable. We've got some new innovations coming in testing, some of which were received on site today, and we look forward to telling you more about that perhaps tomorrow or later in the week. Regarding our hospital assets, we're still in really good shape. 36% of our inpatient beds are open, 35% of our intensive care unit beds are open, and 75% of our ventilators are currently unused in the state. We also have 2 forthcoming data points later this week to share with you. Perhaps as early as tomorrow, we'll be able to release race and ethnicity data on our positive cases. And then later in the week, we expect to be able to report deaths by age range. We try to be very sensitive for patient privacy and balancing that with transparency, recognizing that this is a gray area and that this is new territory for all of us. And so we want to approach it cautiously, but with the public's interest in mind. Thank you.
Thank you, Dr. Piercy. I'll close this portion of the remarks before questions just by saying that we're in unprecedented times. And it is a very difficult time, but I encourage Tennesseans to take heart. You know, hope is a powerful force in the midst of a storm, and we are in the midst of a storm. But take hope. We will overcome this. We will endure this. We will get through this. And we encourage you to do your part by staying apart and being a part of working together with every Tennessean to overcome COVID-19 in our state. Now, we'd like to open up the phone lines and take questions, please. And remember, we have members from our unified command group here, as well as labor and workforce and financial institutions and health available for taking questions as well.
Thank you, Governor. First, we'll go to Kim Crucy with the Associated Press. Kim, your line is open.
Hi, Governor.
Thank you.
Let's see. Late last month, Commissioner Piercy sent a letter out basically warning against using hydroxychloroquine and other medications that have been thrown out there as possible cures for COVID-19. That letter was sent on March 26th. I was curious if that is the department or your administration's stance still about maybe advising against using these medications, or if that's going to be changing anytime soon.
Dr. Piercy, you want to answer that?
Hey, Kim, I think you're asking about chloroquine and hydroxychloroquine, which are medications that originally were produced for malaria, but are typically used for conditions like rheumatoid arthritis and lupus. You're correct. I did issue guidance that was in part with FDA and HHS guidance, encouraging Tennessee prescribers to prescribe that drug very cautiously and under guidelines. Not so much that it has to do with COVID patients, but because there is a large contingent of patients that need these medications for their very common conditions, like rheumatoid arthritis and lupus. We want to be able to preserve the supply for these patients, and what we were seeing is that we were seeing a flood of inappropriate prescribing and hoarding, quite frankly. So we wanted to make sure that these patients had medication for these conditions, as well as if it does come out that this drug is going to be an effective treatment, we want to have a supply in order to be able to treat that condition later.
Have you gotten any just real quickly though, have you gotten any pushback from providers saying we would like a little bit more freedom to do that, or what has been the feedback?
No, ma'am. Really, the only feedback I've gotten several personal notes from physicians saying, thank you for doing this. We saw a flood of prescribing right after that first announcement was made. And in fact, I heard from personal friends that are physicians that treat rheumatoid arthritis and lupus patients thanking me for making sure people are going to still have access to those drugs.
Thank you.
Thank you.
Next, we'll go to Brett Kelman with the Tennessean. Brett, your line is open.
Hi, this is for the governor and Dr. Piercy. Do you guys know if you are going to receive the 5-minute tests for coronavirus anytime in the near future? It was announced today that those are probably coming to Tennessee Walgreens, but I'm curious if the state has any and if they're coming.
Hey, Brett. Yeah, we received our shipment today in the State Public Health Lab. It is limited supply. The CDC parsed those out, and it's my understanding that all states, the State Public Health Labs did get a shipment of those today. And so we expect those to come through our typical supply chains, maybe later this week or into next week. But yes, we do have that first batch on hand.
Next, we'll go to Ryan Breslin with WSMV. Ryan, your line is open.
Hi, Governor. It's Ryan Breslin from News 4. I was reaching out to you because we've gotten a number of complaints from our viewers about golf courses being overcrowded and people not following the social distancing guidelines there. Are you able to tell us why golf courses are deemed essential, and if people aren't following the guidelines there, if you're thinking of having them closed?
I'm glad you bring that up. It's the first I've heard of that particular complaint, but we certainly will take that into account and make the appropriate adjustments necessary. I'm not clear about where those complaints are or who they are, but if you would provide information to our office, we're always looking for opportunities to make certain that people are appropriately socially distanced, and where we see non-compliance with the guidance that we've given, we want to know about that. So, you know what, I don't know about that particular complaint, but if you get it to us, we will pursue that, and we appreciate that.
Next, we'll go to Damon Mitchell with Nashville Public Radio. Damon, your line is
We're
open.
always looking for opportunities to make certain that people are appropriately socially distanced, and where we see, what do we got going there?
No, sorry, seems to be there was some feedback on the line. Apologies about that. We'll continue on to the next question. Stephen Elliott with the Nashville Post. Stephen, your line is open.
Thank you. Dr. Piercy mentioned starting to release some race and ethnicity data tomorrow or soon. Why is that important? And I guess also, why did it take until now to start recording that?
Yep. Thanks, Stephen. I'll let Dr. Piercy reply.
Yes, race and ethnicity data is important to make sure that we are maintaining access across all ethnicities and to eliminate or mitigate any disparities that we might identify. The reason we haven't posted that to now is you've probably heard me talk many times about re-identification risk. And so when those numbers get large enough in each ethnic category, that we can prevent re-identification, that's when it becomes more acceptable to release that information. So we feel like we're at that point, and looking forward to seeing that data tomorrow.
Have you seen any trends in that so far?
I actually have not seen that data yet because we've just now been compiling it. My epidemiologists have been looking at it on an individual basis, but this will be the first time that I've seen it in aggregate.
Thank you.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your line is open.
Yes, thanks, Governor. I believe the Sierra sent out something today calling for you to put a moratorium on utility cutoffs and also allow waivers for late fees and failure to pay bills, et cetera. Have you put any consideration into that?
Well, the Public Service Commission announced earlier that they would, and I'll need to clarify that, Sam, regarding the extent to which that applies, but the Public Service Commission announced earlier that they would not be turning off utilities during this period of time, so I think that's been addressed already.
Okay, thanks.
I'll confirm that for you and let you know for sure, but I think that's accurate.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Thank you, Governor, for taking questions. Yesterday, there was something that kind of went by us, and I don't remember a question. You said ventilators, or you cited HCA for sending ventilators to New Jersey and New York. My question is how many? And I guess that says it's good news about the capacity of ventilators in Tennessee.
I don't remember the numbers that they sent. It seems like they were 400 or something. There was a significant number that they sent. And as you know, HCA is a national company that has hospitals across the country. So that we are really proud that they're located here. But they are certainly a company that serves patients and communities across the country. You know, we do believe that we have a strategy in place to secure the appropriate number of ventilators that we're going to need. We talked about that a few days ago. We know how many ventilators we have. We know how many we have on order. We have suspended procedures in outpatient surgery centers so we can retrieve those ventilators and put them into place. All of those put us very close to the number that we believe that we're going to need. And in fact, those numbers were based on a previous model that is significantly been downgraded. Now, we know that data changes every day, so we continue to plan for the surge, and we're downgrading our belief of what that surge will be, but nevertheless, we are very much focused on making sure that we have equipment and supplies and PPE, and we're not going to stop in those efforts. We do think we have enough ventilators in Tennessee, but so we're very proud of the fact that HCA sent those ventilators up north.
Real quick, if I may, quick question on the PPP from the Small Business Administration. Any ballpark figure when those folks might be able to get some sort of check?
Commissioner Gonzalez, I'll let you answer that. You know more about it.
The program just began on Friday. It's still evolving. It's still being developed. From what our people have been able to tell me, there have been thousands of applications in play, billions of dollars are at play. We do know that some funds have actually gone out. There's still some process that needs to be developed by the SBA, which I think is being worked on today. It may be resolved today. So there's a lot of activity that's going on. There's money that has gone out. There's more to be done. And I think we've just heard earlier today that Congress is looking at additional funding to be made here.
Thank you.
Next, we'll go to Jason Reynolds with the Murfreesboro Post. Jason, your line is open.
Hello, Governor, Dr. Piercy. Thank you. I was wondering, the Nashville Davidson County Department of Health has been releasing case information such as zip codes and that was showing hot spots in their territory. And they were also mentioning how tracing was leading back to large events like churches and fundraisers where a large amount of people gathered and were infected. I was wondering if that sort of information is going to be available at some point to help Tennesseans make better decisions to sort of protect themselves.
Yeah, that's a good question. So I heard two parts of your question there. One was about clusters and one was about zip codes. So on the latter question related to zip codes, that goes back to what I actually referenced just a few minutes ago on re-identification risk. So in large metro areas where there are multiple zip codes, that's much less of an issue. In our smaller rural counties that perhaps only have 2 or 3 zip codes in the entire county, that becomes a much bigger issue of re-identification. And so right now, it looks to be that the most appropriate way to release zip code data, at least in a rural state like ours, is in metro areas. Related to clusters, you're exactly right. Many of the cases, particularly here in the Nashville-Davidson region, have to do with group events and can be traced back to a few weeks ago when people were gathering. And so that further helps us validate our assumption that these large gatherings are driving infection, why it's so important to do your part and stay apart.
That's all the time we have for questions today. Governor, if you would like to make the closing statement.
Thank you. I appreciate each of you for tuning in. We hope that we are continuing to provide you information. We hope that you are encouraged by the good news and that you are reminded by the difficult news of Tennesseans, of us losing Tennesseans or a rising case, that you're reminded that we cannot stop, that we cannot let up, that we cannot back off of our efforts to make certain that we attack COVID-19 in Tennessee with the most aggressive actions that we can take, and that would be you as well. So thank you for doing that. Thank you, Tennesseans, for working together, and we will continue to report information to you on a daily basis, and we will continue to remind you that we will get through this if you do your part and stay apart. Thank you.